people in their what attributes based to people in the middle age get
we're live.
fatigued and what attributes to it, right?
Yep. Well, we're live now, and welcome everyone to the Tiger Peak Performance Group. And I have Dr. Matthew McNamee with us again, as we do so often. How you doing, Doc?
Doing great. How about you, Steve?
Good, good. Well, today we're going to talk about why do you feel tired? And Doc, the first question I want to ask you, is it common for middle-aged high achievers to experience frequent fatigue? Is this a common thing you've seen historically in your medical practice?
Yeah, I mean, absolutely. I mean, I mean, what I do when I connect with people, it doesn't matter what age or what I've historically, whatever I've seen them for. I always like to get a gauge of where they're at with their energy levels. I try to figure out, if they feel well and refreshed and ready to go for the day after sleeping, and where their energy levels are in the morning and afternoon and evening, et cetera, just to kind of paint a picture of what it looks like. And even if people aren't coming to see me with their main complaint being, fatigue, it's not often that I have people that crash in the afternoon, or they have troubles getting going in the morning, or they're just fatigued all day,
Yeah.
So yeah, it's pretty darn common.
Yeah, I see that too among my friends, and almost everyone that I talk to that does their first type of discovery call with Tiger, almost every one of them say they struggle with fatigue, and so yeah, it's very common. And so when someone gets to this middle age, 50, 60 years old, what's driving that fatigue, Dr. Matt? Like, what are the common causes that, you could share with people watching this today?
Well, 50, 60 years old, could be a handful of different things.
Yeah.
That age, some of the hormones in either men or women will, a lot of times be hitting a point where it can affect their energy levels.
Yep.
Women hit menopause, and sometimes, that'll be a complaint where once their hormones drop, they can get fatigue. And then men as well. But, I also have people that are in those ages, 50s, 60s, 70s, that, don't necessarily have those symptoms. And there are things that can, really kind of contribute to that as well. And it's the stress hormones will really impact those sex hormones. I mean, that's what I was kind of indirectly talking about, like, and those ages, menopause and men and such. So the stress hormones will have a big impact. When you were talking about, people, the high performing middle-aged individuals, it's incredibly common for them to have chronic stressors that are impacting the physiology of their body. So yeah. And it has a lot of downstream effects, and it can impact other hormones, and those hormones actually play a role with energy levels as well. So there's a whole cascade of events that events and or a lot of different hormones I look at to rule out to see if hormones are playing a role, because changes in those will definitely play a role in fatigue.
Yep.
Lifestyle, there's a lot of different lifestyle components as well that can affect fatigue. There's nutritional stuff as well. If you're lacking certain nutrients, people have, inflammation in their gut, and they have an unhealthy, digestive tract and the microbiome that essentially go with that. It can definitely attribute to, those symptoms as well. But stress is a big component. It really is with that group of people.
Yeah. The other thing I see too is sleep, and it's, what I've learned from you is it's all that stuff can make our sleep terrible. If we're not managing stress well, and we have unrelenting stress, and high achievers do, because they're people who take on lots of responsibility. They tend to be highly conscientious, and they also have a high capacity for getting stuff done. And all of that's really great, but they tend to perform nonstop in a very upward linear way. And they don't invest in the recovery because they hate timeouts because they're type A personalities like me.
Right.
And, but, and so as they learn, so all of that contributes to that,
Well, it's interesting because, when I test, these stress hormones throughout the day from waking until they go to bed. And there's a lot of, I would say at least half of the people that I work with, somewhere around there, cortisol is supposed to start the highest in the morning, and then it's supposed to have this trend down, and it's supposed to end nice and low so we can get some restful sleep. And a lot of people go down and then they spike back up, which will really impact the sleep and difficulties falling asleep or staying asleep or both. So
Matt, talk real briefly, not briefly, but just talk about you have a different approach to medicine. Okay. Our standard Western system is really based on evaluating what you're telling the doctor, and they want to classify that into a diagnosis. And there's typically a prescription that goes with a treatment plan or a surgery or something like that. Not saying anything bad about that, but you come at it a completely different way to solve these problems. Can you explain that a little bit for our audience?
Sure. Do you want me to just be a general explanation or specific?
Yeah, just general. Yeah.
Okay. Yeah. So when anyone comes to me and they're struggling with fatigue or this or that or the other, my goal is, I'm always trying to figure out what's underneath that, what's driving that process, what imbalance or imbalance is in the body's organ systems. And multiple organ systems may not be working optimally, but they'll show up normal on blood tests.
Yep.
And those imbalances, in different systems will present in different ways. And those are the symptoms that come out. Right. And then some people, they're past that point and they have actual disease pathology in different organ systems, and they may have cardiovascular disease or diabetes or this, that, and the other.
Right.
But I always want to figure out what's driving the process, because there's lots of things. Even with just those, stress can drive both of those things I was just talking about.
Yeah, right.
And sleep imbalances can drive both of those. Obstructive sleep apnea is tied with, high blood pressure and cardiovascular disease, right? So it's all these things, and instead of just going, well, you have your labs look like this, let's prescribe whatever that may be. Let's try to go down, let's go upstream a little bit. What's causing those things? And let's try to address those to ideally eradicate the things that you're coming in with. That's the best case scenario, but I'm very root cause and just try to keep going down to the factors. Typically there's multiple factors that contribute to each person's presentation. Sure. And you can have a dozen people all coming in with the same symptom, and all of them a different reason why. So that's kind of, that sums it up, right?
Yeah, that's the key point you just made there. I actually describe the way you work as you reverse engineer people. Like you get all this data, and everybody's data is different. Same problem, but their pathway to how they feel today is different. And I know, like when you worked with me a few years ago and rebuilt me, you basically did that, all the testing, you reverse engineered me. And the crazy thing was at my regular doctor, my labs were saying I'm okay. And there really was not anything clear to this doctor. And again, I'm not tearing him down. He's my best friend. So he was doing his job the way the system enables him to do his job. But the way that is, they couldn't tell me anything that would be helpful to me. So there was nothing there. And then when I worked with you, you had basically you were asking different questions and you had different data than they do. And because of that, you were able to reverse engineer me and get me healthy again. And now I have all this energy and feel great. And so anyway, I wanted to share that just as a general idea. Like I've heard you say, it's like a puzzle that you're solving.
Right. Yeah, it's catching things early. I had this conversation with my father recently. And he was just changed doctors and had a very similar experience. and was excited about his new dock and but they were really kind of just breezing by some things that I don't believe should have been really breezed by, because
Yep.
he didn't cross that range where he
Yeah.
was in the high, but he was just like tiptoeing on the other side of the fence. So,
Yep.
anyway, yeah, it's not their fault. It's the way it's the training process, and there are a lot of limitations too. A lot of other stuff that goes into it, and
Yeah.
insurance and
Other things, right. Well, thank you, Dr. McNamee. And this is going to conclude our video this week, and we'll see you next week.
sounds good, Steve. Have a good one.
Yeah.